No voice, sir.
Hello, is it there?
Yes, now there.
So, dear friends, we have discussed regarding the chapter number 11, where the role of vital force in the state of health, in the state of disease, and the state of cure, which we have discussed in detail. The Kent has tried his level best to explain and implant in your mind exactly what you have to treat. So you don't have to give importance to the pathology. You don't have to give importance to the ultimates, but you have to give importance to the symptoms which are describing the individuality of that person. And that's the concept which he tried to explain over there in detail. And now he is turning towards the chapter number 12, where he explains how this cure happens. The concept of cure which he has tried to explain, and there are different methods. Hahnemann in those aphorisms have mentioned that you can treat the patients with different ways of treatment, out of which one is homeopathic and other are antipathic and allopathic. But which is the rationale, that also he has mentioned, and that's what we have to discuss. So let us go ahead with the lecture number 12. The removal of the totality of the symptoms means removal of the cause. Organon, aphorism number 70. Now, as in the cure, effected by the removal of the whole of the perceptible signs and symptoms of the disease, the internal alteration of the vital force to which the disease is due, consequently, the whole of the disease is at the same time removed. It follows that physician has only to remove the whole of the symptoms in order, at the same time, to abrogate and annihilate the internal change. That is to say, the morbid derangement of the vital force, consequently the totality of the disease itself. But when the disease is annihilated, the health is restored. And this is the highest, the sole aim of the physician who knows the true object of his mission, which consists not in learned sounding prating, but in giving the aid to the sick. So, we're going to discuss this aspect in detail. What actually Kent wants to explain about this aphorism, how this cure happens in homeopathy, why it happens, where one should look for, all those points which are essential and which Hahnemann tried to explain in this paragraph. So instead of listening my philosophy, let us understand what Kent wants to explain about it. So we'll start with Kent's philosophy regarding this aphorism. So what he explained. The idea of this paragraph is that the removal of the totality of the symptoms is actually the removal of the cause. Actually, this he has mentioned already in the aphorism number 9 also. In the aphorism number 9, which denotes the removal of the totality means removal of the disease in its whole extent, means removal of the cause. And that's what is the Czat effectus Czat causa. The concept explained by James Cross in the introduction. And this again he is explaining over there, that if you remove the totality as a whole, then automatically you can remove the disease and the cause of the disease. It may not be known that causes are continued into effects, that is, the causes continue to in ultimate. But it is true that all ultimates, to a great extent, contains the cause of beginnings. And since cause continues to ultimates, and things in the ultimates shadow fourth cause, the removal of the symptoms will lead any rational man to assume that cause has been removed. This will lead to see that if large number of symptoms manifest themselves through a deceased ori, and that ori is removed, the cause of the symptoms has not been removed, and will manifest itself through some other part of the body, perhaps the other ovary or some organ that is weak. And he is explaining that if your concept is wrong, then automatically things happens to be in a wrong direction. If patient comes to you with a certain symptomatology, for example, pain in right side of the abdomen, in lumbar region, or in hypogastric region, or right iliac region, and that lady, she is having it since long time. She gives that she gets that severe pain when she has to press it hard. She cannot move. If slightest movement aggravates, and it continuously stitches over there. This is what the symptomatology with which she presents. But from allopathic point of view, it doesn't have significance. What they ask, do USG. So patient goes for USG are done, and now USG shows there is right ovarian cyst, because of which that ovarian cyst is causing the pain. So they immediately ask the patient, you have problem because your ovary is having the cyst, you have to remove that ovary, that is the only treatment. Patient get operated. For some time she feels better, and after some time she started getting pain in left side of abdomen. And now again they ask you go for USG, and again they found now there is a cyst in left ovary. So you have not treated the original disease which was in dynamic, which was there in dynamics, but which you have treated the ultimates. Ovarian cyst is the ultimate. You have treated the ultimate with the help of surgical measure without treating the internal cause, and that's why it has further progressed to the another ovary, or it might enters into some other organ, because you have not cured the basic symptomatology. If same patient used to come to the homeopath and patient explains those symptoms are very clear of a bryonia. If you give bryonia to the patient, and next day patient comes, doctor, the pains are vanished. There is no more pain. And you continue, ask the patient to continue medicine for some days, and you ask the patient to take again USG, and you find there is nothing in the USG. So what is the difference between treatment? You have given importance to the symptomatology, with which you have understood the cause which was hidden in the dynamics, and you have not tried to treat that with the help of ultimates, but you have tried it with the help of symptomatology. And once you remove the symptoms with the perfect simillimum, automatically original disease was vanished. And this is what he wants to explain. If you do this, when the patient is at the functional level without a tissue change, without a cellular change, then you prevent the further progress of the disease. And that is the only language with which you understand the internal disease. So, see, Kane tried to explain you the same thing again and again, that you don't look towards the ultimates, you must look towards the symptomatology. The symptoms and signs and symptoms of the patient, which denotes exactly the internal derangement. And if you find it out, apply the law of similars and find it out a right remedy in right potency. That's all. You remove that, automatically the cause will be vanished, which is in the dynamic. So this concept he tries to highlight over there. What he further says, it is a serious matter to remove any organ through which disease is manifested. Very important sentence. What he says, it is a serious matter to remove any organ through which disease is manifested. And this is what done in the allopathy. They used to treat, they used to remove the tonsils, they used to remove the appendix, they used to remove the ovaries, they used to remove the uterus. This is what they do. So this should not happen. When there are two or more of these pathological conditions established upon the body, and one is removed, the other immediately becomes worse. For instance, if there is a structural change in the knee joint and surgeon removes the knee, while there is a corresponding structural change in the kidneys or liver, which he cannot remove, the latter immediately becomes worse and breaks down as soon as the knee joint is removed. In the same way, we find the tuberculous condition of the lungs, that it may remain in a very quiet state so long as fistula in ano keeps on discharging. But the allopath comes along and closes that vein, and immediately there is cropping out of the disease by the infiltration of the lung, and patient comes to an early death. And these examples you often see when you do a homeopathic practice. If you try to remove the organ, considering that problem lies in the organ, then what you do, you just progress the disease from less important organ to the more important organ, from the organs of lesser importance to the organs of greater importance. And when such a thing happens, it ultimately reflects in a grave pathology. So he has given two examples. One example where he explains that surgeon stops the fistula, which is discharging the toxins, which is natural cure which has happened. And if you remove or if you tried that fistula in ano to be closed, then it reflects in the heart, causing the death of the patient because of heart attack, or it may reflect in the original disease which was there in the tuberculosis of the lung, and that tuberculosis increases so fast that it leads to the death of the person. And such a thing happens because you are treating the ultimates, not treating the original disease which is expressing through the signs and symptoms. The results of disease are necessary in many instances. Sometimes these results are tuberculous condition, which are the ultimate outcome or effects from the cause and contain at times the seeds of beginnings of the similar kind. They are not themselves beginnings, yet they contain causes. Unless causes are removed from the beginning to end, disease can reproduce itself. This includes first proposition of Hahnemann as to the cure of disease, which means permanent removal of the totality of the symptom, thus removing the cause and turning the disorder into order. And as a consequence, the results of disease are removed. The totality cannot be removed without removing the cause. So he is explaining this concept over there. If patient comes to you with such a symptomatology, and if you take into consideration all those symptomatology in toto, that is totality of symptoms, and find it out a remedy which is matching to that specific totality, give that remedy, and that's all. Your work is done. And then patient gets cured very easily. That itself means that you have cured the patient and removed that totality in, and because of which that is cause of the disease is automatically vanished, because cause is hidden in the interior at the dynamic level. It is not the cause which is visible, and that's why Hahnemann earlier also said there is no tangible or visible cause or disease present inside the body. Whatever is present is dynamic, and this should be treated with only and only with a dynamic remedy, which is based upon law of similars. And then further he says, but when the disease is annihilated and the health is restored, and this is the highest and sole aim of the physician who knows the true object of his mission, which consists not in learned sounding prating, but in giving aid to the sick. So this is the first footnote to the first paragraph where Hahnemann have mentioned these words. What happens in the allopathic science of medicine? Patient has some pain in abdomen. He goes to a general practitioner. He gives painkillers. For some time he is better. Then he never settles. Then he goes to the consultant. He asks to go for sonography or all those investigations. Then he labels, yes, you are having some pathology. We go for certain thing. And again he asks, you do MRI and you do all biopsy and etc. And then label, you have now a lymphosarcoma of the intestine. A big name is given. Hahnemann says these are the things which you should stop. What you are going to do now? What is your treatment? There is no, now they keep signs up. We have only radiation, we have only surgery, we have only chemotherapy, but now your case is beyond control. We can't do anything. Hahnemann says instead of doing all those theoretical things, it's better to find it out what are the patient's symptoms. Just take the totality, find it out a right remedy on the basis of law of similarity, apply that remedy and give it to the patient. That's all. That is what is needed. So simple is the technique. But instead of that, these people who gets to whom he has labeled by the name the learned peoples, learned sounding prating. So they talks with their big names. They, without giving the aid to the patient, what do? They just talking that you have such and such disease and etc. Hanuman says it is not useful. Hanuman, what he says, Hanuman gives this warning note against the discoursing dogmatically upon the flimsy theories of man. So these are the all theories which are talked by the allopath. They talk with different names of the diseases, and this has happened, might be because of that, might be because of that. He criticizes. He says that it is simple. Ask the patient what is your problem. Ask him what signs and symptoms are there. Match the remedy. Give it to the patient. It was the custom in Hanuman's time for men to cloak their ignorance in technicalities. That is, to use the technicalities for the purposes of appearing wise. It is done at the present day. I have heard physicians talk to simple-minded people in technicality. Wise people seldom use technicalities. And this is nothing in this world so beclouds the understanding as to deal with technicalities. They are cramped and often meaningless. So these are the different big names are given, big words are used, and Hahnemann criticized this method. Instead of that, what ask the patient, what is your problem? Simple, patient is telling, yes, he is having pain in right iliac fossa, which is teaching, he is not able to move, aggravated by slight movement, better by pressure, better by rest, and he is having constipation along with that, he is having thirst for large quantities of water at long intervals. You get the whole totality with which you can find right simile. Instead of giving name to that disease, if same patient goes to the allopath and they say you have appendicitis, now you have to remove that appendix. If you give briny on the basis of this symptomatology, finish. That's all. This is what Hahnemann wants to explain, that instead of giving big names to the disease, it is meaningless. The doctrines of homeopathy should not be clouded in technicalities, but should be considered and talked out in simplest forms of speech. When talking of the Organon, its doctrines talk good English. If you are English, use simple forms of speech. One technical word will sometimes mean a whole sentence and can be constituted to mean a good many different things. Technicalities are a sort of scapegoat. Scapegoat म्हणजे बळीचा बकरा. Technicalities are the sort of scapegoat to carry off the sins of our ignorance. So if you are talking in such big words which is not understood by the people, then it is a rather difficult thing. People never understand what they are having, and you are talking such in such a sense that you are showing that you know all things, but it is not so. You Hahnemann says that instead of that, give the medicine, and you don't have the medicine. That's why you talk in such a sense. It is always better to talk in simple English. Ask the patient, what is your problem? Wrote down what the patient says in his own language and find it out a simple remedy. So every sentence uttered by the patient, which whether it is directly a part of parcel of that problem of his disorder, it doesn't have significance. We have to treat that individual. Whatever the symptoms or whatever the sentences uttered by the patient gives you a lot of things, and that's what you have to catch. So, in a simple language, he is explaining what you have to do. You have to do only one thing. You have to find it out what is the totality of the symptoms of the patient. And then he further goes. We'll finish this paragraph and we'll stop. The totality of the symptoms means a good deal. It is a wonderfully broad thing. It may be considered to be all that is essential of the disease. It is all that is visible, represents the disease in the natural world, to the eye, the touch, and the external understanding of man. It is all that enables the physician to individualize between diseases and between the remedies. The entire representation of the disease is the totality of the symptoms, and the entire representation of the drug is the totality of the symptoms. It does not mean little independent symptoms, but it means that which will bring to a mind a clear idea of nature of sickness. Many of the little symptoms that occur can be left out of the total without marrying. But the essence, the characteristic, the image must be there, as that is of importance to the physician. being him the sole indication in the choice of remedy. So he is explaining very clearly that what is the importance of totality of the symptoms. You have to take into consideration all this totality, which should be consisting of characteristic symptoms. And that characteristic symptoms defines you and individuality of the individual. It is not all symptoms which are necessary. There are certain common symptoms are also, which doesn't have a significance, which never individualize the individual. But there are symptoms which characterizes that individual, and that makes you to differentiate one remedy from the another remedy, to match the remedy, and that is the importance of totality of the symptom. And if you get right remedy on the basis of this totality of the symptoms, you can treat that patient very clearly. So what he says further, it is true that the old prescriber may be able to perceive the totality if he can see only a small portion of it. Prescribing in that way, however, is very often a mistake, for when that which was wanting is brought out, the physician sees that he has prescribed only for the side view, or as it were. You become well acquainted with the old friends and know them by even partial view or by gait or voice. But it is not so with strangers. Strangers have to be studied, criticized, and examined. It required long time to know the stranger's methods, to find out how he performs his business, whether he is cheerful or not, to know the character, to know the man. So it is with the totality of the symptoms, for to a great extent, every sickness is a new sickness. So what he is explaining exactly that you find it out a remedy on the basis of totality of the symptoms. There are old practitioners or who are used to for these. They look towards certain partial things and they catches the remedy. If you are familiar with that patient since long time, then you can catch it very easily. But if if the patient is new for you, then you are stranger for him, and he is also stranger for you. Then there is no other method. You have to take into consideration whole totality, not just on keynotes. Everything is important, and you can find it out a right remedy. So he says it is with the totality of symptoms, for to a great extent, every sickness is new sickness. If the patient has nothing to conceal, he will delineate his symptoms cheerfully. But he has something to conceal, it becomes hard matter to obtain the totality of his symptoms. So he is explaining about the totality of the symptoms. So he is explaining over there exactly that if the patient has nothing to conceal, he will delineate his symptoms cheerfully. But he has something to conceal, it becomes hard matter to obtain the totality of the symptoms. So if the patient is explaining you the totality, it becomes a rather simple work. But if he is not able to give exactly, that you cannot get a right remedy. This is too important to understand over there. But this totality must be obtained, for there is no other means of ascertaining the nature of the remedy that he is in need of, and as it is expressed in the 18th paragraph. And what he explains in the 18th paragraph, from this indubitable truth that besides the totality of the symptoms, nothing can by any means be discovered in the diseases wherewith they could express their need of aid. It follows undeniably that the sum of all symptoms in each individual case of the disease must be the sole indication, the sole guide to direct us in the choice of the remedy. So he is explaining in the 18th aphorism that is the only thing with which you can achieve a perfect cure with the help of right remedy. So totality of the symptoms is very important entity, which is the sole guide in finding it out the remedy. So he is explaining all those details in this philosophy, and he is making it fix in your mind what one should look for. So we'll stop over there on this point, that totality of the symptoms and it's important. And mm, for the student's point of view, The whole answer of the totality of symptoms is hidden in this specific aphorism and explanation. So we'll stop over here with this point, and tomorrow we'll continue with it. There was one question asked by Prasanna sir for de-addiction, acid salt 30 or 200, which is helpful. 3 doses, 15 minutes interval, or 1 dose 1 month for. No, acid fluor is very defecting remedy. It should not be repeated for a month. Very important, give 3 doses, and that's all. And then wait, there is another remedy which you can repeat is Quercus. Quercus is very good remedy for de-addiction and which you can use. That can be used in mother tincture, and that is a good remedy which is given in Boix Mater Medica. Acid sulf is only a defecting remedy, should not be repeated too much. Okay, any other query? So if there are no queries, we'll conclude and we'll meet at 8:30 with the another part of Naxwamika. We have discussed only introductory part of Naxwamika yesterday. Today we're going to learn much more about Naxwamika in today's session. So be there at 8:30. Thanks a lot, and we'll meet tomorrow again with the philosophy.